Hello, this is Dr. Caroline O'Sullivan, and you are watching Holistic Pet Care with Dr. O. Today, we are so fortunate to have Erika McElwey of Change Your Reign out of Holyoke, Massachusetts. So we are playing some time change stuff going on between Arizona and Massachusetts to get this thing done, and now the computers have given us some issues, but we're back together, and we're going to spend an hour talking about the incredible services that Change Your Range and Erika provide, which are over the top creative, and I'm very, very excited about talking to her about this. And for folks that are watching this, we are going to record another YouTube after this is done, where Erika's actually going to consult with me about my dog, who would benefit greatly from her services, I guess. So thank you very much, Erika, for being here with us today and spending your valuable time.
Awesome. Thank you for having me. I'm excited.
I know, me too. I mean, so tell us a little bit about who you are. And I actually had to look up the letters behind your name, and now I know what they actually mean. And tell the world a little bit about who you are, and first of all, why you do what you do, because that internal drive from your gut or your heart or wherever it's coming from is so important with holistic. So if you don't mind starting there, I would really appreciate that.
Yeah, absolutely. Absolutely. I come from a massage background, and my training, or the initials after my name, are EqCnTPM, stands for Equine Canine Trigger Point Myotherapy. And the thing is myotherapy has been around for many years now, and through the course of massage and in different types of therapies, I have found it to actually not be in the forefront. So I seem to be somebody who's had my certifications. I've certified since 1999, had a wonderful teacher, and have had my hands on dogs and horses since. It's just never gone away. And I enjoy it, and I've taken it to another form of rehabilitation. I've worked with Dr. Mike Stewart out of Windsor, Connecticut. We had one of the first hydrotherapy rehab centers here in New England. Very low-key, casual, trying to keep everything affordable for patients and clients, and we've continued to do that. And now I have my own place, Change Your Range, here in East Hampton, Mass. So I'm on my own and working with vets all over the world and patients to help bring this to the home and allow it to be, it can be center-oriented, or what I do now is a lot more video consults. So this is what's exciting about you and I connecting and doing this kind of stuff is like, let's get the word out there that, the 15 years of the history and my experience now has me being able to, not teach others, but help owners work with their own dogs, because a lot of these cases need day-to-day care and hands-on work, that if you're doing something day-to-day, let's make every step count. And that's
Erika, you couldn't be more right, because what my dog Ambate, who we're going to meet, he has a bunch of things happened to him, and one of them was he blew both of his knees, or his cranial-cruciate ligaments, or whoever knows the terminology. It'd be two sports injuries in humans: ACLs, football, baseball, basketball injuries. He blew both of his knees at the same time, and he went and had bilateral TPLOs. Tibial plateau leveling osteotomies. So they're these huge surgeries, and done by very skilled surgeons to get him back up. And he's an 80-pound big boy, and our options were help him go to heaven, fix his legs, get him up, and there was a lot of craziness with it, but it was a $5,000–6,000 surgery. That's without rehab. That's without underwater treadmill work. That's without all of the rehabbing that we did with range of motion and the physical therapist. And then I happen to be a holistic veterinarian. So I've got my skill set and my acupuncture and my electrostim and my spinal massage. And then I've got a certified massage therapist that comes to the house every other week to give him a massage. So he's not lacking for services, but I'm so thrilled that you mentioned the money piece of it, because I know a lot of people don't even start down the road because of finances. And if you could just spend a little time with that, because I've got a lot of respect for you having that be in the fore of your consideration with what you do, because a lot of people it's not, and I've got the utmost respect for you. So if you could just kind of touch on that a bit, because it's a huge thing, isn't it? It is a huge piece of the decision making with these guys.
It is, and through the start of my career, I got to say that, maybe that wasn't in my forefront, but it was in, the vet that I worked for, its forefront. So I learned that from him, and how do we make, this work so that we can continue to keep together. A lot of the vets will refer out. You mentioned the orthopedic surgeons, these big TPLO surgeries, orthopedic surgeries. The orthopedists that we have are great. They're excellent. Their surgeries are phenomenal. But again, it brings us back to, we kind of always indulged a little bit further besides, okay, here I have a rehab patient who's the TPLO post-op, 6 weeks, 12 weeks, and I look at that more as, okay, why did these knees have a problem in the first place? We have to go back to why are they not coming out with basic care? There are animals that do. They have the injury, they go through surgery, they need very minimal range of motion, home care, and they're on their feet and back rocking again. So my question, why is it that there are some that don't? And that brings us back to the prior to surgery of life, and it could be a few months of life, it could be a few years, some are middle-aged when this happens, and it really comes back to the movement. So we really start to look at how dogs are moving from the start. So it needs to come into that we have to spend time re-educating the body how to walk again correctly. Because they will go from point A to point B, whether it be 1 leg, 2 leg, 3 legs. They don't care. They're so happy. This kind of stuff doesn't impact them when pain finally leaves. But sometimes the pain is gone, and yet they're still residually limping, and we need to figure out why.
You're absolutely right. You can be more correct. And then that thought process is so holistic. I mean, the whole idea of, start from the beginning. It's not just when did you see him limp? When did you get the surgery? When are you 14 days out? When are you, with the post-op rehab? It's not that, it's a continuum. Like, why the heck are you here in the first place? And how did this little guy or girl start out? Or what happened in the beginning? Or how did you see the gait? Or what did they look like before? Or what are their deficiencies? What are their excesses? Those types of things. And it's a huge undertaking, isn't it? And you've got an amazing skill set that I've honestly never even heard of. So I'm so excited about this. But I'm glad to hear that you go back to the beginning with your clients. Now, how do you find that re-education with your clients based on folks that usually have a Western education from white coat veterinarians that are, okay, this happens, so we'll do this surgery and give you these meds and then go home and everything will be fine, or pay for this series of 8 underwater treadmills and then go home and everything will be okay? But it's very, different, I guess I should say.
Yeah. The different part of it is that not every case, I call it, is that cookbook approach. The ones that are the ones where they fall and hurt their leg. It was a circumstance. Some of them are hit by cars. It was an accident, and it happened, and now they have to get healed from all of that injury. The ones that are more that I find have a harder time with that cookbook approach are the ones who have been residually moving in an inappropriate way for a majority of their life, and now it's finally the last straw that broke the camel's back happened, and why both knees on your dog went at the same time? Why both? One should happen, the other one should happen. Yeah, all of a sudden they kind of go down, but we watch these guys and look at it. So I have been over the years working with folks that I can try to educate them for the now and where they are today, and hope that we can avoid this for a future case. Okay, so I try to really hit that education side.
Yeah.
In really, a lot of them I don't see until after they've had the surgery, after they've had their first set of rehab. I have other clients that have called me, talked to me, spoken with me that say, I already have done that, it didn't work.
Right, right,
And
right.
not necessarily how they're working or how the therapist did their job or how the vet has done their job. It's really about opening up a new pathway within that body, and it really goes back to the brain and body, connection.
Yeah, and
So
that's such an awesome way to be thinking, because as you mentioned, you just kind of went over the trials and tribulations that I went through with being I told you this on the phone earlier. I said I'm my dog's mom, and I'm my dog's vet, and I'm my dog's referring surgeon. So the guys that when I presented my dog to my surgeons in Las Vegas, who are just superstars as far as I'm concerned, and he went down both cranial cruciates, blam, same moment, same time, and you're exactly right. It's from underlying historical Jing deficiency. There's stuff, right? Stuff. So
yeah.
my surgeons, they did bilateral TPLOs. So the same time, same surgery. Nobody does that. Just because you're saying, one knee goes, they fix that, and then even the weakness or the stress of the contralateral leg from the stress of being off this leg, and then the other one might go. And you have those numbers in Western medicine, about 60 to 70% of ones that lose one knee are going to lose all of that. But my surgeon did bilateral TPLOs, which is like a no guts, no glory move, and then my dog had every single type of Western rehab, including these guys have an underwater treadmill. They have a tank, which is a big deal. And all the people with the right letters behind the name, the right experience, the right kindness, the right this, the right that, the right herbs, the right everything. And still, he's a poster child for what you're saying, because it's something else. It's something else. So, and I really applaud you for your owner education and your owner information, so that not only will they feel more comfortable with what you're doing and be helpful for their loved one, but do you find that it increases animal advocacy, or people say, oh, you could probably start earlier? Or how does it move you to where people maybe get preventative versus reactive or post-op all the damn time, which is what I see a lot?
Yes, and again, if we go back to that, the affordable option is that some of these clients can't afford the surgery where you are up against. We either, transition them to heaven, or we fix and do the surgery, and that $6,000 or $5,000 doesn't always happen. We have a lot of options. A lot of owners are doing crowdfunding now, and we have so many different connections over the world where people can help these types of cases, but it's not always the case. And I come across clients numerous times, and a lot of them are my vets, my veterans that have these dogs as their buddies, and something happens and they're on a limited income. They can't afford that kind of stuff, and they lose their friend. And I'm there preoperatively. I'm there to do the best that we can, so that we can see what we can do. And if surgery is necessary, we keep them comfortable, raise the money to do what we need to do, find somebody to help fund it, and then we go forward. So I end up becoming more of that, the advocacy part for them with their veterinarian, offering different options, and then being able to go back to that if that is the only answer. Sometimes. Just give me 1 second. I have a battery issue. I just want to make sure I plug.
You got it. Go ahead.
1 second. Thanks.
No problem. Now, so Erika, she practices a very integrated type of therapy, I guess, where she offers so many services, and we're going to get into that. Gait assessment, treadmill training, strengthening, neurological repatterning, which is a thing that is so new to me, and I'm very excited to talk to her about it. And like I said, we're going to have another show with my personal dog, and she's going to go through what she would go through with any type of phone consult with new clients. So we're going to be talking about that. Low-level laser therapy, which is one of my faves, and then magnetic blank therapy. I've done that in Vegas, and I'd love to hear how she's using that in her arena. So I think she's back. So we are back to talking to Erika. So is our battery crisis averted?
Yes.
Yay! Yay! So
give me the dog that can't walk, I'll be fine. But the computer's not working very well.
I'm like, you know what? You speak the truth. I got to be honest with you. When I first got involved with this or asked to do this, I'm like, I'm just a lowly veterinarian. I have no idea what you're even asking me to do. So I'm glad you figured it out, because the same thing would have happened to me, I swear. So back to you, Erika. I spent last night reading every sniglet of information I could find about you and your organization and what you do. I was really, really excited about your sessions for folks, starting at the beginning, let's say, not necessarily with me, but just in general. I was reading, we have gait assessment, treadmill training, gait strengthening, neurological repatterning, which I really want to spend some time on because I'm really excited about that. Laser therapy and magnet blanket therapy, and we can, put those, to the side, or maybe that's a different show, right? Because those two things are awesome. But so tell me, somebody calls you, or maybe like I'm calling you on the phone, or brings doggy into your office, or you go to Eddie's Wheels or wherever it is you go. How do you start, or what are you doing, and how do you decide what modality you're going to use, or what do you do? Yeah, that's it. What do you do?
Yeah, I know, right? Well, first, you observe, and you watch the dog, you watch their movement, their look in their eyes. How is each case being presented is going to give you the options of what you're feeling. So a lot of this, in a sense, I'm a healer. And this was my job, I guess, that I was born into. I found it along the way, and I've come in and out of it. But I definitely know that when it comes to that intuition, you don't get initials after your name for intuition. You can't certify for your intuition. And I will probably say I have a lot of other therapists that we talk to, and it's like, well, who taught you that? And they're like, well, I just do it. And I'm like, good. Good. I'm glad you listen to it, because there are some people that are by the book and they say, well, I didn't learn that in school, so I don't do it. And, there are things that kind of come with it. But anyways, I just have the great experience of working with vets hand in hand. I open my doors all the time to have the communication and the flow of information. So in doing that, I have seen cases that here I might have stumbled over back in 2000, and now in 2009 I was able to see a similar case that responded well to something that somebody else had done. Right. And so you look at that history, and you take that history and you learn from it. Yeah. So a lot of times it's just, on a quick limb, I go to Eddie's Wheels on Saturdays. I'm there. Great opportunity. I deal with a lot of neurologic patients there. They're there because they can't walk very well, or they're stumbling, tripping. And so in a very brief moment, we get a few different things. And some of the things that I find that really just, that are nutrition deficiencies are number one. It just shines through, whether we're overweight, underweight. The other thing is that there are thyroid components to a majority of cases that cannot recover efficiently. Our intervertebral disc dogs, why did that back go in the first place? And it can be from some ligamentous problems that have been going on in their system prior to that. The same thing with the ACLs. We can have deficiencies. I hear our buddy, he's waking up now. But so I look at the dog, I feel them. There's a certain feel to a dog who should be, carrying themselves. That muscle tonus is important for the present.
It's okay, buddy.
When you feel that muscle tonus, there should be a certain way that it responds back to you, and then the lack of response is there. So all of those things are taken into play pretty quickly. If it's a young puppy, then we're definitely looking at, deficiencies and supportive nutritional care. If it's an older pet, and sometimes I meet them and they're going into hospice situations, and I meet them and they say, it's you or else. Man, does that not put me in a position to say, why are you coming to me for the last resource? And what's been amazing is that in some cases I see, I may not exactly know where we can go, but the response in the first 24, 48 hours is the most important, and that'll give us the hope or the chance to know if we can move forward. And I have had miracles in the sense that dogs that haven't walked for months or even a year have been walking and mobile maybe until their transition point. That's 6 or 8 months later. Again, there's all sorts of things that we can do here and get into about. But hi, buddy. How do I pick a modality? It starts with the hands-on, and my modalities start with what I can offer an owner for them at home. So I always resort to my hands first in what I can offer in the sense of movement or types of massage or range of motions or reflexive therapies that I can give to the owner that day on spot and say, we're doing these, we're getting responses, continue to do this, and then contact me in 24, 48 hours. a lot of them contact me later that day and go, I can't believe it. We're getting somewhere.
Yeah.
And there we move on. So I don't ever resort to my magnetic blanket or my laser or my treadmill and something that I'd have to have a client spend money to order. I give them what they can take home that day, maybe for a consult fee with me, or even just the hope of, let's pray that we can get somewhere.
Mm-hmm.
The clients start applying what I've given them, and the day-to-day process of that application then opens up new avenues.
Nice.
My magnetic blankets and my lasers that I work with, I have a great company. The magnetic therapy is good because an owner can buy a magnetic blanket. Mm-hmm. And for what they can spend in therapy, day in and day out for weeks at a time, I kind of get them to apply it to what they can purchase for their home care program, and be able to get that going. Now, the company I work with has rental ability, so you can rent it for 3 weeks. If you need to rent it, you rent it, and then you send it back. I like that because it supports my home programs. And our IVD dogs, dogs that are, just inflammation from Lyme disease. That's another one. That's a whole other piece of a thing, is the Lymes that's going around, or tick-borne diseases. All of these play a part, and they're never, I say, they just sometimes don't follow the rule book. Mm-hmm. So when regular Western medicine is applied, it just doesn't look like it's that. Yeah. So I end up finding it, but through what the body's telling me. And then we go back to the vets and we ask for more help. And
I have to interrupt you there. This is so funny because when Gabate, who you just saw back there, when he went down, I ran blood work on him for every viral disease, I got Babesia, I got every blood pathogen, I got every tick-borne disease. I did the CBC chem. I tested him for myasthenia gravis. I tested this dog for everything. I tried to give him thyroid. I tried to give him TGAA, the autoimmune antibody for the thyroid. I tested this dog for everything, hoping that it was something that maybe was I wasn't even sure which way I wanted to hope for, but I wanted to eliminate every damn thing it could possibly be except for neuro, except for bilateral, what the hell is going on with my dog? Because he's falling apart. There's got to be something that is Western that I can actually, not one stinking number, not one in 7 pieces of lab work was off. He's the perfect dog in Western medicine, except for bad knees, which we both know is just not true. So I appreciate you saying things about not getting tested for this, or not, not thinking about Lyme disease, or not this or not that in a Western sense. And that's a huge financial outlay to do that kind of testing. I mean, huge. And so I really appreciate you doing that, but it makes me laugh because I'm like, and then maybe that's not it.
Right. And then now what? Right. Exactly. You've come in, you do it, and you get no answers, and yet you sometimes still get a response to something. And it's a practice of medicine. It's not it's not an exact science. It's a practice. So I try to, I always spend a lot of time. I advocate for my dogs to the vets with the owners, but I also advocate for my vets to the owners that say, no, your vet is fine. Your vet is doing exactly what they need to do. Your surgeon is wonderful. It's not their fault. It's how we're going to open up, Fido, and how we're going to get him or her to the next point. And, it really, my vet doesn't know. Well, no, your vet does. He's doing great, So I do. I become the advocate for both sides in that point. And that's, that's where it is. But it's amazing to me, from what I've learned with the trigger point myotherapy, which I find to be a lot different than some of the other massage schoolings that are out there. It's all great, but one thing that myotherapy taught me was a lot about the fascia and the connective tissue, and how that myofascial release is important. And then what brings me to the other levels of how that fascia moves, and in the reflexology of, okay, this reflex triggers that one for neurology, how that fascia can be impeding that response.
Yes.
So it's kind of, you have to look through the layers, peel it like an onion, and get down through the core. And the core ends up being the information center, which is the brain. and how does the brain respond and how does it come? And I've had the unfortunate of a lot of family and people and close friends that have had injuries, but they've recovered. They've had major brain trauma, and they've recovered. It's amazing what that brain can do.
So that's what kind of drove you beyond the myotherapy. I mean, you have the myotherapy, and then, like you said, you're kind of looking through this web of whether it's fascia or energy or wherever your words are, and then you did self-study to get to where you are now with your repatterning of the neurological system. And like you say, starting with the brain, but that's something that you just kind of went outside the box and self-educated and just kind of discovered, because I know there's no certification in neurological repatterning in veterinary medicine. So you're an innovator, yes, and that the things that you do, they work, right? I mean, it's another modality to give us hope. They give us hope, right? So that was all you stepping outside the box and going, there's got to be something else, or it was driven by family and stuff like that. I mean, you had to hunt and peck. I mean, there's not a book that says, here, do this, right?
No, and unfortunately there's not. I will say that I read a lot, and I read a lot of educational things on my spare time, but what really took this to the next level, I had been doing this type of work for my intuitions and what I was getting the body to do. So you ask the body to perform one way, it's expected to be one way, and you get something, and how do I make them equal back to normalcy again? I've always been doing that, and that was the help and the guidance of Dr. Mike Stewart, the veterinarian that I worked with he worked with racetrack horses and did a lot of equine medicine, and then took that movement and lameness movement work into dogs when we started the rehab center in Connecticut. And that is an invaluable source of information that I don't believe we get enough movement assessment from other sources of education. You can talk about it, but until you actually see it, map it, and know the difference, that's even the difference between a pace and a trot. Not everybody knows the difference. and the two of them equal body mass and matter in two different ways that support the back in two different ways, or don't support the back, and therefore we have to fix that.
You are so funny, Erika. When I very first started vet school, very first started vet school, I was an older non-traditional student, but had a lot of horse experience and such, and we were in the barn, and they brought a filly out, and they just went up and down the alleyway, and the veterinarians there said, so what is wrong with this filly? And I said, well, she's pacing, and she's a quarter horse, like that. And he looks at me and goes, and I said, she's not supposed to be pacing. She's supposed to be trotting. And everybody turned around and looked like, well, what the hell does that even mean? I mean, what does that even mean? Because she was moving on four legs, and she was standing up. She wasn't neurological. She was just pacing. She wasn't trotting. And I can still remember the doctor. He goes, so you've done horse? I said, yeah, I've done horses. He goes, okay, you have to use veterinary language. I said, that is veterinary language. I was like, that's just what she's doing. I don't know how else to explain it, but it's not right. It's just not right. That's so funny you would say that. So if you would take a minute and go, that's so funny, because it brought back this whole picture. I'm like, yeah, she's not supposed to do that. That's wrong. He's like, why is it wrong? I'm like, she's the wrong breed and wrong everything. I don't know why it's wrong. It's wrong. Like, that's so funny. Would you go ahead? Before
I go on that, I just want to finish like the whole idea of like how I intervened, or how I did my own intervention with bringing on what I do. What really tipped me to the next level was actually the birth of my children. I have been doing this now since 1999. I did become pregnant and had twin girls in 2004.
Okay.
And let me tell you, 2004. Where are we in the world? 09. Okay, yeah, we're in 2009. I just missed 5 years. Sorry. They're 5 now, and my one daughter was born with some disability, and a lot of it ended up being some brain trauma and some stuff just due to the birthing process and being a twin, and they labeled it as cerebral palsy. Well, of course, getting into that point, it drove me as a stay-at-home mom with a motive to heal as I am. I remember looking at her and going, Mom, if she was a puppy, what would I do? Sounds crazy, but I did.
It's
but
legit.
I would tell you, reading about the cerebellum, reading about the cerebellum and what cerebral palsy means and the different levels of it. Because you say cerebral palsy, everybody goes to those that are in a wheelchair and are disabled fully. Mm-hmm. There are many levels of it. Mm-hmm. And my daughter doesn't have a severe level, but enough of a level where if we don't intervene, we won't see the success.
Right.
So that started to teach me there about, wow, I'm reading all this stuff, and I'm saying, well, this is what I do with dogs. I remember calling Leslie up at Eddie's Wheel saying, oh my gosh, you know what this means for our nerve dogs? You know what this means this means I have answers to what I've been doing. And we chuckled and laughed, and I've been putting that in and reading on autism because, again, some of that becomes behavior and patterning. That word patterning came because in the autism world, it's a world of patterning. Mm-hmm. And the world of what we don't want them to do is pattern. Mm-hmm. Well, I'm looking at them and saying, well, some of these dogs that I see in the world of they walk this way, they shuffle this way, now they have knee surgery, they're only going to continue to walk the same way they've been. We need to change that. Yeah. And in order to change that, we have to change it on the brain level. Mm-hmm. It just started to make sense. And it is a force in me that says I'm going to make it happen, and we have. We have nerve dogs that have been down for years, and through the successes and work that Eddie's and myself have been doing, we have them walking.
That's beautiful.
It really has opened up a whole new way for me, and where I believe the future of this and even our talk here today is going to go because of that.
Yeah, so, yeah. You gotta love it. Now, I would like to ask you, can you put into words, I guess, what it is that you do? I mean, what is neurological repatterning? You look for reflexes, and then you try to open up different collateral pathways through the spine. Or I'm such a neophyte at this. I am going to turn this over to you for a second because my dog that you just met now managed to get himself in the bathroom and wants to come out. So I'm going to go on mom duty for a moment. So please entertain the world, and I'll be right back.
Great. So thank you, Dr. O. So the idea of neurologic patterning and realizing that we can change this started with my work in the underwater treadmill, understanding that we can do a little weightless exercise, and realized how good weightless exercise was for our dogs with neurologic issues. It's not that your neurologic issue changes by getting in the water. It's that your weight and your buoyancy changes. So that means that there is a connective response. If you can put your dog in the water and they can swim, and you can put your dog on an underwater treadmill, release 3/4 of the weight, make them only, a quarter of their weight, 20 pounds versus 80, and they're moving their limbs, it means we have connection. It means that there is nerve response. The reason we don't get them to walk on land, and why if it wasn't a water world we can't succeed, is because that strength to nerve ratio. There's not enough strength when the nerve triggers the motion to nerve that muscle. It means that muscle is not strong enough. So when we put them in the water, we get that buoyancy factor, start to get that nerve that's functioning but only able to give 20% signal, and the muscle that we have is only 20% responsive. That's where those factors start to come into play. So I have learned through the reflexive therapy process that we can start to achieve with support in getting what I call normalcy and weight bearing. Going to the water, there's no weight bearing. However, sorry about that. We get a little bloop. And when we have no weight bearing, we can get function, but the brain works in two ways. It needs feedback in order to have another signal respond. So I have done a lot of work with getting them in the dogs into normal posture with the work of Eddie's Wheels, with therapy stands that have come out, and we can look into that for therapeutic benefits.
Right.
Individual stands for dogs at home, so that these owners can do the same work. We have wheelchairs that are either front wheelers or rear wheelers. We use quad carts now so that we can get feedback on all four limbs back to the body, which leads me to the reflection. We can trigger the reflex instead of looking at the drug response for what's there for feeling, utilizing it to say, if I get that feeling, do I get them to respond back to me and resist? And then you response. So I'm sorry for that. Is there something there?
Oh, there's just a little bit of feedback right there for a second. That's all. I'm sure it'll be fine.
Okay. So that was my philosophy there. So that goes to with the reflexology stuff, that if we can start to use our reflexes to get the brain back involved, because the brain's only triggering the signal. It had already sent the signal months ago, and it wasn't getting a response back, so it stopped sending that signal. And we get that when we start healing and learning about people that have had brain injuries, and their part of their brain is gone. It's not there. Yet we can get them to walk again. We can achieve them to feed themselves again. We can achieve healing. And that is where it means that we have now these therapists that worked hard in the human world to feed these people, to get them to do it on their own, and now the brain has been remolded. The brain is now taking on a new memory in another location of the brain. And that's why they're able to have that response now. And so I've taken that from the world of my nephew with injuries, who's healed miraculously, my daughter, who I did not want to grow up being a patterned autistic child, and every time she wanted to stim herself, I gave her something else to do.
Yeah.
We've created the succession in the feedback. So I've taken my nerve dogs who have been doing these same things, given the owners these types of exercises and options to do. We can be doing them right out of surgery. We can be doing them right at the time of injury, and stopping, instead of saying, okay, we're going to go 6 weeks, 12 weeks, IBDD dog goes into a crate and gets very little activity until everything is healed. By that time, what we end up finding is they walked right after surgery, but as the time has gone on, they've worsened. No, they haven't. The brain stopped sending the signal because it wasn't getting a response.
Right.
These guys doing certain exercises and activities at a very valuable point, and then learning how much do we do and when to stop. And those are things now that we're starting to work into.
You bring up a really good point, especially with the folks that are able to either go to surgery or they decide to go to surgery, and they have these very large detailed, whether they're ventral slots or lateral, excuse me, I've got dogs everywhere now.
Really low right now.
Oh, excuse me. Let me get the space. There we go. Is that better? Is that a little better? Okay. Well, you mentioned that the people get frustrated with it, that these animals they're good when they come out of surgery, and then over time their situation declines. And I've got one of them sitting right here in the bathroom. I got to be honest with you, but that the neurofeedback curve that you're talking about, and I'm using a different language than you have, but that. And then whether it's the brain or the spinal cord, the relapse arcs, and these types of things in neurology, they don't get that feedback, whether they're memory walking or brain walking or spinal walking. It's referred to in many different ways. I find that to be extremely important. And that, like my boy, he being in a cart, or like you said, buoyancy, underwater treadmill walking, taking that pressure off the pads, or having the pads hit pressure plates in order to give that feedback, whether the dogs know they're actually doing it or not. All of those things are so intimately involved, but sometimes we don't do that post-op because they seem okay, and then as we watch them gradually decline, I can tell you personally and professionally, that leads to a frustration level that is unmappable. I mean, just unmappable. The frustration, the sadness, the watching these guys decline after they've been through so much. And I confess to you, after my boy was in his 2 surgeries and one of his TPLOs failed, he had to go back to that surgery again. I literally promised him he would never go back to surgery again. I mean, it's such a huge event, and he's got some other issues. So watching him decline, or getting my clients to say, we've tried everything and he was doing well for a while, but now you're our last hope, or I hope you have something that's going to fix him, because so it's very frustrating. So the things you're saying are very exciting for me personally and professionally about being able to address these things. So that's wonderful. I really appreciate that. It's awesome, and I'm excited.
Like I say, on the side of addressing it, you can't ask these guys to do too much. So to say, okay, let's go to a therapy session, what do I do for an hour of therapy? My hour of therapy is about talking to the client and educating my client, because I can only do 10 minutes of this exercise because that's the point where they're at.
Right.
So I keep going off. It keeps sending me to another
Uh,
screen. So we'll keep going.
it's just a little variety. It just adds some variety. That's all right.
All right, great. Here I am. No, I'm not. Peekaboo. So I educate the clients, and I'll send them home with a series of things to do. If they are with me locally, we might do check-in appointments that are 10, 15 minutes long, maybe no more than a half an hour. We're doing a little laser therapy. Laser therapy now is so fast, which is great. But, by the time we get through doing all the laser points that we need to do and getting back on track with an assessment, yes, we can move forward. We bring it back to the owner. So this is where my home programs become so valuable for people, because by the time they get time off of work, spend the gas to get here, some are traveling hours to come, others are taking weekend trips from where they are to come and stay with us. They can do 2 days in a row of therapy. It's really profitable to get online and be able to be with you in your home. So when we go to work with your boy today, you're going to get firsthand on that, and
Right.
then see. And our session, may not be an hour. You may not be able to handle that. We're going to ask these muscles to work in a way that they have not been working, and
Right.
therefore he will shut down because of fatigue.
Yeah.
And therefore, it's great that we can jump online as long as all communications go well. The session and we're gone again gives us, more hope and more time that you're doing this more routinely at home. It becomes a part of your day-to-day routine rather than sessions per week when it comes to therapy and sessions.
That's so vitally important, because you're exactly right, and it translates directly. In my practice, you come and you get acupuncture. The actual needles. It's you got to be a licensed veterinarian with extra postdoc training to do it. But I can teach you how to do acupressure. I can teach you how to do some really great massage. I can show you the meridians. I can show you places. I can teach you how to do thermography and detect areas that are blowing heat. I can teach you how to be attentive. Close your eyes, use your palms, pay attention to your dog or your cat or your bird, whatever it is. And then we have our little maps, and that your specific case, if you could do this point and that point and this point for 15 minutes every day while you guys are going to sleep, that would be awesome. And the consistency of opening flow and relieving obstruction and those types of things is not to be done once a week for 30 minutes, because you're going to get reperfusion issues and you get lactic acid issues. There's stuff that happens. So you providing us skill and information education, especially with the blankets and the lasers and stuff, where people can continually be involved in the recovery of the animal, and that your pets or your patients aren't getting a once a week hit or a once a month hit, and then we just send them up here and then they go, oh, and then we see them when they're back down here. The skill set that you're providing,
they can't maintain, so then you start getting this wave, and
yes,
and
yeah, awesome, yeah.
Myself, I know that my insulin shouldn't do this, and so my patients learn that as well. They should go up, plateau, and keep climbing, be the best they can be. And as they decline, we support that as they age in years to come. And then obviously we make decisions when there's no other options. But it's great that, and that's what I see, and that's what's the best about it, is that I had clients that were coming and regularly, and they say, I can't afford this. I lost my job. Something's changed, and my heart breaks. I say, okay, well, that doesn't mean you're stopping sessions. And they look at me, and I go, I have a heart. It got me into this, and I'm not letting go. And they'll pay me more in the long run down the road. They give me, presents for my kids, whatever. I mean, everybody works, but I have to make a living. But it doesn't mean that because that changes in that world that they can't afford to continue doing stuff. So I've tried to build my programs for everybody, that no matter what you're in, that everybody can do it and be treated the same. I don't want to offer one something that I can't offer to the other just because of money.
Yeah, and God, honestly, God bless you for that, because it's so important. It's a very different way of thinking, isn't it? Or yeah, there's no way I'm going to say don't come to the office because you lost your job. I'm like, I'm here to help your dog. I mean, I'm here to help your dog, and I get that you're here and you drive him around and you've got the wallet, but they just need my help. I mean, they just need their help, and so we'll work it out later. I mean, I do a lot of the "we'll work it out later" thing, but I totally hear what you're saying. So, in the short period of time that we have left here, and we're going to be revisiting each other a bit because you have got so much to add to our conversation here and to add to the information pool for all of these wonderful animal lovers. Can you tell us a little bit about your take on magnetic blanket therapy? Now, I had magnetic bags. We actually made magnetic bags when I was practicing in Vegas for people to use. Most of it was my arthritic dogs, it was my pain dogs, my can't move, more post-op dogs, aging dogs is what we ended up using it for. And I gotta be honest with you, I did have a rare earth magnet one time go. I had it too close and they went right on my finger, and the two elements, and it hurt. It hurt. We actually made the beds, and the strength of these magnets, the polarity of these magnets, and the rare earth magnets. Is like, there's a lot you got to know about these types of things. It's not just like go and get a magnet and throw it down on your dog's bed. And what direction does it go? What's its polarity? Is it a rare earth, or is it? I mean, there's a lot you have to know about these things, and so you ought to buy them, not try to create them like we did. Because oh my gosh, it was a whole other schooling session, wasn't it? My gosh.
It does, yeah. There's been different magnets and different companies that have come out with all different things for many years. Since I've engaged in this practice for 15 now, I have one company that I've been working with, and they have a blanket, a magnetic blanket therapy that we do is a pulse magnetic, so it changes polarity. So it's positive and negative. Body
Nice.
is made up of this. If we go back to chemistry, there's positive and negative charge to all the ions in the world and in our bodies, and it's on a cellular level. And we understand through some studies that when we have pain, all positive or all negative, that can congregate there. That can be also why the flow changes to get this back and forth. So I use a pulse magnetic circuit. It's called PEMF, pulse electromagnetic frequency.
Huh?
A lot about this PEMF therapy now, that there's modalities that have come out very similar to MRIs. They create MRI, and people have been coming out of the MRI better. It's the strength of that field. The strength of the magnetic force is how quick you can omit the surface. So if it's a stronger force, you can quickly and get the body to respond in minutes. If it's a lesser degree of force, it's going to take longer to get that done. So I have incorporated dogs into me to do massage. I put them on the magnetic blanket. It runs for half an hour. I'm doing massage therapy. We get more out of each session. I really do feel it. And I do have dogs that just don't take to it. They am on it and they don't like it. They get fidgety. They don't relax unless I turn it off. You have to read them. You have to know what you're going through.
Well, you have to know what you have to know what you're doing, but also, let's say, having a PEMF blanket on a dog that's got titanium plates or a pacemaker or pins or those types of things, even with some sort of some of the lasers, you have to know if you're actually making a micro vibration that you and I maybe can't feel for some reason. Like you're saying, maybe some of your dogs get fidgety, they don't like it. They feel it, and in my case with my big boy here, we would never use hard strength electromagnetic fields. He has 7. Well, right at this point, I think he's got 16 bolts in his legs holding metal plates on. So you don't put magnets. Or for humans and these dogs, if you have a pacemaker, if you have any other kind of equipment, any kind of prosthetics. So I just beg people who want to try and do this on their own to be so careful and be very, very well educated, informed, and ask people such as yourself before you make a commitment like that, because it's always first do no harm. Always first do no harm. So just kind of a little call out there, a little kind of yell out there that ask the people.
Company too that I work with is that they take as a referral. So I work with the clients. I know the dogs. We've gone through the history. We know what we have. Make sure that referral for them have a home purchase is safe and the right thing for them to do. Because, yeah, there are a lot of issues, and even when they come in, I have to ask my clients, is it safe to turn this on around you? You have a pacemaker. You have
Yes.
anything going on. Is this going to bother you? So, yeah, there's education there that comes with it, most certainly. But we have used it on them, but again, it's how you use it, and you can introduce a field in a smaller form and work with the other parts of your dog's body. We can get into that more rather than actually having his legs on it, because the vibration, like you said, on a micro level, can still be very bothersome, and too early on in TPLO could actually loosen things up.
Yeah, that's exactly right. So you have got so much darn information, it's ridiculous. That's all there is to it. So we have to do another show with you, because I got questions about the horses. I'm just horses in my past, and I recently have a new filly that I've got, and just stuff. And I read all of your information about the horses and the range of motion. The things you have to say about in just that section, with your palpation skills, all of your stretching, your massaging, hoof care and anatomy, and those are they're so important. I mean, so important. I know we're talking about dogs right now, but with your permission, I would like to do another one of these shows with you, just talking about horses, if we could, and your, the palpation and the biomechanics and the hoof balancing and those types of things. If you're up for that, that would be so great, because I think that's a whole nother hour at least on kind of a separate topic, but so important. And then, as I said before, for everybody who's interested, we are going to film a consultation session with our lovely guest here and my crazy dog, so we can see how this thing works in real life. And God bless you, Erika, for putting up with me as being the mom vet in our next situation. And for those watching, Holistic Pet Care with Dr. O has an affiliate program on Blog Talk Radio /Sylvia Global, where I've got almost, I think, 70 different shows, different topic, different guests, that we all work together to try and get as much information out to increase animal advocacy. So if you can get together like us on Facebook, Holistic Pet Care with Dr. O, Twitter at Dr. O DVM, and I'd like to ask Erika to tell the world how to get a hold of you or any of your social media and those types of things, because you have got a skill set that I've actually never come across, and I really admire you for it.
Well, thank you. I really appreciate being here, because again, the advocacy part that fits so well, the education side is a piece that I've been wanting to do more of, and this is going to allow that to be.
Yes.
ChangeYourRange.com is the website. Change Your Range on Facebook, you can look us up. LinkedIn, we have all those accounts, and email changeyourrange@gmail.com, or you can always call, and the phone number is 413-887-1773.
Right on. All right. Well, thank you. Thank you so much for your time, and we will be seeing you back repeatedly. And I hope that we can do some work together off the air or off whatever you call Google Hangouts. But whatever it is, I don't understand it. But we have a lot of things to work together on, because I think this is going to be such a wonderful addition, not only my life, my family, but my practice. I'm very, very excited about this. So Erika, thank you so much, and I will see and talk to you again very soon. So don't go anywhere, okay?
I won't. I'll be right here waiting.
Thank you so much. I'll talk to you soon. Bye-bye.